we're back on Campaign de Cuellar.
Hi, everybody.
It's somehow crazier now, this campaign, because it's crunch time. And it's January 6th today, which is Layla's birthday.
Happy birthday, Layla.
Yeah, so initially it was a good day. Dia de los Reyes. I remember watching college football in the hospital room, watching Jameis Winston win the championship. But then obviously January 6th happened, the infamous January 6th. Still a good day, though. Because obviously,
it'll help people remember her birthday. They'll be like, "Willie's birthday." No, I remember.
So we went to Barnes & Noble yesterday to get her gifts that she selected. So we got a bunch of books, got a couple Malcolm Gladwell books. We got the Ice Pick Surgeon. I thought it was for me, but she took it.
Right.
I don't know.
But it's bigger than just buying her books.
Beatles lyrics.
Because you said that you've always wanted books growing up.
Well, that's one of my goals in life. That was one of my goals in life. I don't need a lot. But my goals were to not be poor, to buy whatever book I want, have a nice car, help my family. All that's done.
Check.
Yeah. So that's all I really need. So,
yeah.
Oh, and also I forgot my white coat, just FYI.
Yes. Well, you don't know where it is.
I don't know where it is, but I was reminded that I actually need a new one because I need to get a new one that says Ada Cuellar, MD, JD.
Yeah.
Yeah. So it's fine if I've lost it. It has to be somewhere, I think.
Maybe Comet has it on.
Probably in a car or something.
And then a big day as far as your social media team or your comms team. They sent out a video, a comparison of you and your opponent.
Right. So I think this issue is really important. Obviously, we care about all the issues, and there are some that are more priorities, such as healthcare, education, the economy, immigration, and energy. But I think abortion is also really important.
Tell the people
Well, really
why.
The issue of reproductive freedom. Well, as a doctor, I really understand the issue, more so than my opponent in the primary, more so than the incumbent, Monica de la Cruz. And that's why we need a lot more doctors in Congress making decisions, because what we've had is a lot of non-doctors making decisions, and then we get laws that don't make any sense and that actually endanger the health of women. So obviously, I've seen things on the front line. I've seen lots of patients with ectopic pregnancies, miscarriages in process, things like that. And the laws that we have now in Texas really don't make sense medically and also really morally, in my view. And so the issue I have with my primary opponent is that he essentially said that he can't do anything in Congress. So he went on a podcast with a pastor, and in my view, the pastor is very extreme. The pastor said that he agrees with no exceptions for rape. Personally, if I would have been on that podcast, I would have been a lot more disagreeable about that because I think that that's ridiculous.
Right.
On this podcast, he stated that he is running for federal office and that this is now a state issue. And as a result, he's not going to be able to do anything. And there will not be more abortions if he's elected. So there are multiple problems with that. First of all, if you think you can't do anything in Congress for this issue, then maybe you're not qualified because you don't really understand what we can do in Congress. There's a lot we can do in Congress. You know, the issue, of course, is writing a bill that could withstand the Supreme Court. And that's something I understand because of law school. So I think that I can actually write bills and have a strategy so that we can enact laws to protect women that would withstand a Supreme Court challenge. So that's one issue I have. And then also the other issue is you can't say that you're pro-choice, although he's never actually said that he's pro-choice, but you can't say that you're pro-choice in the sense that you don't want to make decisions for other people, but at the same time say, well, I can't do anything. So that means we still aren't going to have a choice.
Right.
Lots of problems there. And in a state like Texas, I think it's unconscionable to say that you can't do anything for women's health care, for reproductive freedom, because we have an extreme abortion policy. No exceptions other than these situations where a woman's health may be at risk, but then that's very confusing for the doctors too, because it's very vague, the law. They're afraid of being convicted.
And I think to remind the audience, you are an emergency room physician who sees when women get raped.
Yeah.
And they come in to get care.
Yeah.
And how quickly a miscarriage can turn deadly.
Right.
And maybe people don't understand that miscarriage is a synonym for abortion. When we're in the ER, we cannot say Miss Jane Doe is having an abortion. I mean, a miscarriage. Our word is abortion.
Spontaneous abortion.
Complete.
Or incomplete abortion. Complete abortion.
There's different, because that's the medical terminology.
Yeah.
So when you are stepping in and saying no abortions, you're saying no health care for a woman who needs it.
Yeah.
So we published the video yesterday about the contrast between you and your opponent.
Yeah.
And we had a woman call in today and wanted to share her story with Dr. Cuellar.
So she had an ectopic pregnancy. So what an ectopic pregnancy is a pregnancy that doesn't implant in the right spot. So it doesn't implant within the uterus where it should. It could implant in the fallopian tube. And obviously that's not going to work out. And women can bleed to death once that pregnancy essentially ruptures. So what happened to her back in 2024 was that there were multiple delays because of the law. Both delays in trying to get the methotrexate, which is the chemical treatment, and also a delay in the surgery as well. And thankfully, because she had a really good doctor, a really good OBGYN, she survived. She was still able to have another baby. She just had one.
6 weeks ago.
Yeah, 6-week-old baby.
And she was pretty emotional because that was a pregnancy she wanted.
Right.
And unfortunately, it implanted, as Doc said, in the wrong spot. And you can't have a fallopian tube, guys, is small.
Yeah.
A baby cannot grow in a fallopian tube. And so if what happens is, as she stated, her life is at risk.
Yeah. So laws like this, they end up just causing unnecessary delays, and they can harm women ultimately and possibly kill women ultimately. The other thing is that a lot of people don't understand, especially if they're not doctors, is that the extreme abortion law in Texas is making us lose doctors, is making us lose OBGYNs. There was an article written about the Valley fairly recently about how we lost really good OBGYNs due to these laws, and how bad some of the medicine was that was being practiced here in 2015. That wasn't that long ago.
Right.
So these doctors came in, they brought in a lot higher quality OBGYN care, and they ended up leaving because of these extreme abortion laws. So it doesn't just affect women who are pregnant or who could be pregnant. It affects all of us when we're losing good OBGYNs.
And that same woman that called in, she also has a 10-year-old. And she was very emotional because her 10-year-old could have been left without a mother.
So people don't really think about all these other repercussions that can be had because of these extreme abortion policies. And I also want to go back to the exceptions, because I don't think it's right morally to not give women the option to have an abortion when they were raped, when they were a victim of incest, or even when they have a baby that's not going to be viable. So the situation I always talk about is anencephaly. And what that means is a baby that is born with no brain. So they're either not going to make it through the pregnancy, or they're going to die shortly after. I've seen maybe survival to a year, but not very long. And it's not a meaningful life. So there's no exception to even abort a pregnancy like that, even though ultrasound shows you that there's something massively wrong with a baby. And what a lot of people who are not doctors don't understand is that pregnancy is a high-risk condition. It's physiologic, meaning it's natural, but it's still high risk, right? And so a woman can die from eclampsia, from HELLP syndrome, stuff like that. So laws where you make someone take a baby to term that is not viable like that are just wrong morally. Mm-hmm. And so, yeah, I don't know. I'm actually getting pissed off right now.
Well, it's just hard because we've been there in the ER when you have a woman present and she's bleeding out.
Right.
And it's because she still has contents of the pregnancy within her. And the body is trying to abort it. That is why the word is abortion. And so when you can't help the woman to abort, that's what happens. Modern medicine helps the women get out the extra material, and then they're able to survive. But we had a high maternity death rate, which that actually will probably increase with all these changes.
And also, I'm a leader and a strong leader. And so it really angers me to hear someone say that they can't really do anything, because I'm always going to try to find a way to do something. And I think that in Congress, there's a lot that we can do. So to, give a weak argument like that, like, well, I can't really do anything because federal office, that's not leadership to me. I'm just getting more and more pissed off.
It's a tough subject. We just talked to that woman, and
Yeah.
it's just heartbreaking. It makes your gut just sink.
Well, it's just so many levels to this, so many wrinkles to this that people do not understand. I've seen women that died just from the fact that pregnancy is a high-risk condition. So to make someone go through a pregnancy with a non-viable baby that doesn't have a brain or some other really massively devastating condition, it's so wrong. And we absolutely can do something in Congress. And like I said, I already have a lot of strategies as to what we can do to write bills to protect women.
And there was actually another local woman who had the fetus no longer had a heart tone.
Yeah.
She had the fetus in her body for 9 days.
Yeah.
Because the insurance company wouldn't cover it because of all these changes.
Yeah.
Day 11, she gets a fever and calls the insurance company and says, if you do not pass this, I'm recording this call because if I die, it's on you. So finally they agreed. And finally the doctors here were able to do their due diligence. But
yeah,
I mean, that's a case where that could have happened. She could have died.
So I would like my primary opponent to imitate me on this and stand up for women and say that he's going to try to codify Roe v. Wade. I think that that's the message that I want out there.
A good message.
Yeah.
And I think the women appreciate it.
Yeah.
So with that being said.
Yeah, that was a heavy episode. I'm going to need to rest right now.
We thank you guys for joining us again.
Yeah, don't forget to go to drquadforcongress.com and donate.
Right. And we'll see you soon.